Hi everyone, welcome back to Simply Healed, and today we are very happy to have a very special guest, right? It's none other than Dr. Johann. Dr. Johann is the Executive Director of the Asian Lifestyle Medicine Council, right? Yeah.
Yes, that is correct.
Yeah, and he's the head. He used to be before he was promoted to the whole regional executive director, he was the head of the Philippines College of Lifestyle Medicine. He's the advocate and he's one of the pioneers in this field. And those of you who constantly listen to our program, you're always looking for like natural solutions to health problems. Well, you can't get any more natural than Dr. Johann. So, Dr. Johann, thank you for joining us this day and welcome.
Happy to be here. Happy to be here.
You know, if you guys love this, we will try our very best to get a very busy Dr. Johann to be a regular on this program. Dr. Johann, colon cancer, you know, it's one of the big cancers for both male and females in Philippines. What is your experience with colon cancer? I mean, is it something that you see many patients have? I mean, in proportion to all your cancer patients that you deal with?
I see more people with prostate cancer and breast cancer. I do have a certain percent of patients who come to me with colon cancer. Absolutely.
For prostate cancer, it's a slow-growing cancer, but in general, for colon cancer, by the time patients come to you, how many months do they have left? Do you often see patients who are late stage or early stage?
Usually because, the signs and symptoms of colon cancer, they're detected when it's fairly advanced. So people with colon cancer who come to me, usually they already have stage 3, stage 4 colon cancer, which is usually the late stage colon cancer. But I have had like 2 or 3 patients with very early colon cancer, and the reason why they were able to find that out was incidental. You know, they were having a colonoscopy and then they found out that they had a small tumor somewhere. But most of them, it's usually advanced stage. Yeah, that's true.
What's your experience or success rate with colon cancer? I mean, especially since they are in an advanced stage.
Yeah, we have had some success. Okay, I won't even say a lot because it is late stage, but we have had some colon cancer patients who are now, living the life that they've always wanted to live because they have completely reversed their cancer, even with an advanced stage. And some of them were even my very early, early on in my practice, when I was working with special nutritionists who were purely plant-based and had lots of training with cancer patients. So I was working with some of them, and just using diet protocols, they were able to reverse people with advanced stage colon cancer. So that was for me, was eye-opening.
Wow, Dr. Johann, on our Simply Healed program, we actually have oncologists that work with us. We have lifestyle medicine practitioners like yourself. So we realize that even among our own doctors, there is a wide, range of philosophy and approach to treating cancer. But for today, we know that you are like one of the authority in terms of treating cancer naturally. I wanted to ask you, the patients, even in the late stage colon cancer that you have helped reverse, did you actually use a combination of integrative like chemotherapy and lifestyle, or was this achieved purely on a lifestyle medicine approach?
Hear the knocking?
Yeah, I can hear the knocking. Yeah. Okay.
Yeah, I apologize for that. I have no control over that, but it sounds different. Oh man, it's pretty loud. Let me just tell you about some of the successes I've had.
That would be great. Why don't you tell us the case studies?
Patients, they actually did undergo some regular intervention, like surgical procedures.
Yeah, for colon cancer, that's normal, right? Just cut it out first.
So they would cut out the tumor completely. For some of them, they had to get a colostomy because they couldn't, it was too big a chunk of colon that they could not re-anastomose or reconnect the colon. So they had to take it out and have a colostomy. For others, though, because they were small, they would just cut it off and then reconnect, and they would have normal bowel movement. So one of the patients that I'd like to tell you about was one of the first colon cancer patients I had, was stage 4.
Wow.
Okay. What they did was they simply cut the colon and then put it out. So they did not take the cancer away. It was there. Okay. It was still inside. And this was with my friend who was a nutritionist. Okay. A doctor in nutrition. Can you believe that? So what they did for 2 years, okay, they simply fed this person through a tube.
Wow.
They fed this person through a tube of blended plant-based whole foods. Wow. One of the main ingredients was brown rice. Can you believe that?
Yeah, wow.
And so this is what this nutritionist did. I was there to simply observe and learn, and of course guide in terms of helping with the nutrition part, right? And after 2 years, they couldn't believe it. The cancer had, the tumor had completely regressed, so that they could reconnect. They could reconnect the colostomy. They could reconnect.
Oh, wow.
And the person can poop again normally.
Wow.
Okay, so complete reversal, stage 4. It's crazy, but it's true.
Well, Doc, but for stage 4, it would mean that it had metastasized to other parts of the body. So
that's right.
How did you mean the tumors that metastasized to the other parts did they also regress?
They couldn't find it after 2 years.
Wow, fantastic. So for all the listeners out there who really are very excited about natural, there you go. There is that possible. There is hope. There is hope. But Doc, I mean, honestly, some of our panelists that have been on the show, they are like yourself. They also advocate and what we say, encourage patients to do lifestyle changes and approach. But again, there is that aspect also. If you have, for example, a more aggressive form of colon cancer and you wanted to go natural, right? Would there be like a cut-off point? Like you try for 2-3 months, if we don't see the tumor shrinking and it's in fact growing faster, then you would change the protocol to a combination of oncological and lifestyle. Is there a guideline so that we also don't want, sometimes our listeners get too excited and they get too gung-ho, and when they need to, they don't. So is there a guideline? If someone wants to try natural, at what point should they say, hey, maybe let's go and take a look at oncology again in combination with lifestyle medicine?
Absolutely. I mean, I work with oncologists as well. So I completely agree that if a tumor is very, very aggressive, okay, then we do have to stop its growth and stop its spread immediately. And of course, salads and fruits, they won't cut the bill if it's a very, very aggressive tumor. So yes, I do recommend these oncological interventions, especially for very aggressive tumors and very aggressive cancers. But apart from that, I primarily use lifestyle management. So I leave the oncologic interventions to the oncologists. They're the specialists in that. That is their field. But then I come in as supportive treatment with, things like the Simply Nature product. I use that a lot. Wow. PPARs, plus of course the proper diet. And I even encourage my patients to do exercise as much as they can, with what their limited movements may allow. So all these interventions I still do on top of the oncological treatment.
I think the biggest takeaway here is those of you who want to go natural treatment for colon cancer, first case example gives you lots of hope. But before you go all gung-ho, I think the best solution is to actually book a consult with Dr. Johann. To book a consult with Dr. Johann so that you will know how long you get to try and what's the right protocol so that you can get the good results. Dr. Johann, what other experiences can you share with us? You shared this one, which is really amazing. What are your other experiences with colon cancer?
So that was a fairly middle to late age person, that first one I was telling you about. But I had a recent cancer patient.
Okay.
She was a mother. Okay.
Wow.
And she had a tumor in her colon. What they did was they cut the tumor out and then reconnected her colon so that she could poop normally. Okay. And then she came to me. So she had the surgery done already when she arrived at my office. Right. So we did several tests. Her tumor markers were high. All right. So we still know that the cancer is active somewhere in her body. It's probably not manifesting as a tumor yet, but it's still there because the tumor markers, the CEA, was really high. So we did this. We did the lifestyle medicine, purely lifestyle medicine. She did not want to risk chemotherapy. She was afraid of chemotherapy. I mean, that's her call, right?
Yeah, that's her call. That's her
the
call.
Patient's decision. So she didn't want chemotherapy, and she was also taking care of a little baby. So, so there was a lot of things that she wanted to continue doing. And she knew that if she did chemotherapy, she might not be productive. She might not be able to take care of her kids anymore because
because there will be downtime. There will be downtime, especially the first few cycles. Yeah.
That's right. So I said, okay, let's do this then. So I put her on a completely plant-based diet. Okay. She is more strict than me now.
That is so rare for Philippines, right? Because most patients are so ill-disciplined when it comes to lifestyle change.
She's very strict with her diet. I absolutely salute her commitment. And also she got into a very active routine. So it was like I would say a boot camp thing for I don't know. They do all sorts of exercise routines.
Oh, wow.
It's crazy. It was like she was training in the army or something, But that's what she did. She was very committed to it. Wow. And so now it's like several years now. Okay, we've been following her up year after year. I think it's been 3 to 4 years now. Okay, and all her tumor markers have remained within the normal range. In other words, right now, she can literally be said that she has no colon cancer.
Wow, that's fantastic. And this was a stage 2, 1, 3 patient?
3.
Stage
3. Yeah.
Wow. So it did metastasize or it was just spread around the colon?
Yeah. Around the colon, there were some lymph nodes that they found, the cancer in. So yeah.
But that, I mean, compared to the first case, the stage 4 one, that one was crazy. Yeah, that's crazy. But there's so much hope for all our listeners out there today. Doc, do you have any experience with colon cancer and using PPARs like our liquid extract with your patients? Yeah.
The second cancer patient I was telling you about, she went all in with the PPAR.
Oh, the one that you just mentioned, the one that's 3.
She had liquid PPARs as well as the tablets. She was taking that, and until now she still takes the tablets.
That's why I was thinking, because seldom do people after operation and cancer able to do boot camp level soldier training. Yeah, but that's really common. I was wondering, was this patient on our extracts and tablets? Because then this answers my question. Yeah, because it really does help their recovery much faster. And of course, her discipline and lifestyle change is so key. Wow. Well, Doc, thank you. I mean, we wanted to keep this short. Do you have another case study to share with us? Or
there's lots of cases, and it's very similar. The thing is, if the cancer patients that I have that did not do well, let me just say.
Okay, that's great. I think it's really good to know what not to do when you meet a great doctor and not get the results. So can you share with us what happened to, what are some of the reasons why some patients did not react well in their fight?
So number one is family support. Support from the family and immediate community. That is number one. A lot of my patients who actually eventually died because of their cancer, many of them had very poor support. And this is why when we have cancer patients, we have to understand that these people need our love and support. There was this one patient I really, really feel sad for, because she she was only stage 2 breast cancer. Okay.
Oh, that's so treatable.
deviate a
That's
little
like,
bit.
yeah, that's like almost 80% treatable.
That's right. That's right. Stage 2 only, right?
Yeah.
And she came to me by herself. She had no family with her. I asked that her family would come on the follow-ups, but the family never came. And as we kept following her up, she would come to the office. Okay, she would do all the protocols right by herself, but then she would always complain, "Doc, you know what? My sisters are teasing me, telling me that, oh, you know, you're so, in Filipino, you're so maarte." I don't know if you understand that, right? But I think our audience will understand that you're so maarte. You that's all you eat. I mean, you know, why are you so KJ? Why are you so killjoy? It's just sometimes this person is a cancer patient.
Wow.
What were the sisters thinking? You know,
Yeah.
we're trying to save the patient and they're teasing the patient. So she had absolutely no support from the family. I am so sad to tell you these guys, but we have to support these patients. And eventually, just 1 year later, finally I meet the sister. And the reason why the sister comes to me is because she has to almost carry the cancer patient to me, because the cancer patient is now very weak. And just in 1 year from stage 2, she now has stage 4.
Wow.
She was trying her best, but she had no support and she was always by herself. And so eventually she would start eating the foods that I would not, you know, I did not recommend, because there was no support. And this is why she was not able to stick with the protocols and survive her cancer, which should have been very survivable. If stage 3, stage 4 cancers are being survived by some of my patients, many of my patients actually, why can't a stage 2 survive?
Wow, correct. Wow.
So, yeah.
You know, Doc, I just wanted to say that, you know, this is why we love working with you, and why Doc, I believe this is why Doc Johann, after so many years, we're still good friends and supporting one another. Although I want to complain online in front of many people, Doc Johann is so busy and very hard to get a hold on. So, you know, it's really, but you know, it's been a really good friendship and working experience, especially when we are able to help the patients. You know, Doc, I just want to share with you that our mantra here is that, you know, with you always from start to healing. You know, this is what our promise is for those of you who avail a consult with Dr. Johann and our team here in Simply Heal, Simply Nature. You know, we're gonna be with you always from start to healing. You know, one of our healthcare specialists who is lifestyle trained as well, you know, she actually cried with the patient and their family as they went through the challenges. But you know, we have so many wonderful stories as well. And thank you, Dr. Johann. Now I know why. I mean, had this patient come with us on your journey, we could have helped her not be so alone. You know, yeah. But what, apart from family support, what are the other key factors that we should take note of so that we have a successful fight against cancer?
So if we have good support, then, you know, it's very easy to follow the other protocols, like the food. Nutrition is number 1, exercise, okay? And of course, when I talk about nutrition, since PPARs, as we know, is a very potent anti-inflammatory food, I use that because one of the main reasons why people get cancer is inflammation.
Yeah.
And we know that PPARs is anti-inflammatory, and that's why I have that as my main supplement when I'm dealing with cancer. And so apart from the PPARs, apart from the nutrition, the exercise, then other aspects come in as well, like drinking enough water, like sleeping enough hours, not getting stressed too much, or being able to manage your stress, okay? Avoiding smoking, avoiding alcohol. These simple lifestyle changes are very powerful at helping individuals get healthy and, you know, gain back their health. So these are part of the protocols that I use.
Wow, thank you, Dr. Johann, for sharing that. And really, it does sound like family support is so important. I mean, it's so hard if you're trying not to smoke and all your brothers are smoking in front of you. It's so hard to eat a plant-based diet if everybody's eating crispy pata in front of you. I mean, levity aside, I mean, we want everybody to enjoy our programs, but this is a serious matter. However, there is so much hope. You know, Dr. Johann shared stage 4 cancer patient able to recover almost totally naturally. You know, and the other one is a stage 3 cancer patient who actually did go through surgical procedures, and after that has been cancer-free for the last 3 years and doing well, completely normal. Well, if you want to have a successful fight against your colon cancer, or in fact any other forms of cancer, Dr. Johann is available for consult. Right? Simply drop us a note right now. Just type in right now that you would like to consult Dr. Johann, and our healthcare specialist will help you arrange a booking, and we will be there with you throughout the journey. We will be there to support you, your questions, and also your protocols, and and we look forward to having more of you share your wonderful stories of how you beat colon cancer. Dr. Johann, I think you have stirred up a lot of questions, so I can see there are many questions popping up. My team is telling me people are asking them questions. So if it's okay, any last words from you, encouraging words or words of wisdom or words of warning before we go into our live Q&A?
Yeah, so basically we want to do the basics. We want to follow the basics of keeping healthy by eating a nutritious, absolutely healthy, mostly plant-based diet. You want to be very temperate with your lifestyle. You know, too much indulgences can actually do you harm. So just make sure you're getting enough of all the good stuff and trying to avoid all the bad stuff. And I hope that we all remember there is always hope. As long as there's life in a person, there is always hope. So never lose hope. Never lose hope.
Doc, you know, when you say that, I couldn't help but see an image of the very heartwarming and heart-touching story of why you went into lifestyle medicine, about that particular patient of yours. I mean, thank you for sharing that with me, and it just flashed in front of my eyes when you said, you know, as long as life, there is hope. I remember what motivated you to go into lifestyle medicine. I want to encourage everybody, and so take care. We'll jump right now into the live Q&A.